Hi, I'm Dr. Pennau with Oral Surgery Associates of Colorado Springs, and we're here to talk today about what to expect after wisdom teeth removal. So once you've awakened from your anesthetic, you'll find that your lip and chin and tongue will all be numb. That should persist for most of the day. Oftentimes now we're using a long-lasting numbing medicine that lasts several days as well. This keeps the pain to a minimum. When you wake up, you will have gauze in your mouth on both sides. Generally, we have you change that gauze every 30 to 40 minutes until the bleeding subsides. Typically, that's only a couple of hours. Bleeding up to a day can happen and is not abnormal. Excessive bleeding, let us know if that is the case, and we'd be happy to take care of you and talk to you about it. Also, tea bags certainly can help. What you should eat. Generally, you can eat fairly quickly right after your sedation and you're up and around and able to swallow foods well. Typically, we ask that you eat soft foods and avoid carbonated beverages. Stay away from things that are hard and crunchy. Also, small particulate type foods like nuts and rice and things like that can get stuck down in the sockets. We'd ask that you would avoid. Generally stick to things of a consistency like oatmeal, applesauce, yogurt, mashed potatoes, that kind of consistency. If you can squish it through the tines of a fork, that should be good to eat. It is important to keep hydrated and keep your nutrition up. So I do ask that you continue to drink good fluids and make sure that you get enough nutrition. Generally, pain and swelling does increase for about 2 to 3 days. It typically plateaus for a day or so and then tapers back down. It is not unusual to be sore for 5 to 7 days, but it should be on that arc where it gets worse, holds, and improves. If you start to have increasing pain around day 3, 4, or 5 that isn't subsiding with pain medicine and rest, that's something that we should know about. That would be a concern for potential dry socket or infection, and we'd be happy to take care of you if that's the case. Pain medicine. What should you do? It's best if you can alternate pain medications. If you're taking Tylenol and ibuprofen, you can stagger them. Each of the medicines should be taken only every 6 hours on their own. But if you take one of the medicines, such as ibuprofen at noon, at 3 o'clock you could take the Tylenol. Then at 6 o'clock you could take the ibuprofen, and at 9 o'clock you could take the Tylenol. That way you're not taking too frequent of each individual medicine, but you're having a fairly constant stream of pain medicine in your system. Icing is also helpful. Icing on and off, 15 minutes increments on each side is very helpful for the first 2 days. After 2 days, you can switch over and use heat packs if that's more comfortable for you. Generally, I would expect swelling to occur, and that peaks around day 2. The swelling should be fairly soft, and the skin should be not hard or tender or red. If that's the case, please let us know. Also, things to avoid after wisdom teeth removal is sucking on straws, smoking, or forceful spitting. It is good to rinse your mouth with gentle saline or saltwater rinses, but the irrigation syringe that we give you, don't use until day 5. If you go in too forcefully and blast out the clots, you're going to end up with a dry socket, which is certainly uncomfortable. They're not dangerous, they're not infections, but they hurt quite a bit, and we don't want you to have that happen. Typically, the incidence of dry socket or postoperative infection is quite low. It usually runs national average around 4 to 5%. Also, postoperative instructions should be given to you in your folder, and they're also available online if you'd like to read any of this further.